Hi everyone, our subject of discussion will be peripheral artery disease. So let's start. By definition, it represents stenosis of the peripheral vessels like arteries, and disease is very similar to other like carotid artery and coronary artery disease. On a carotid artery, we'll encounter symptoms like headache, claudication, syncope. On a coronary artery, it's a classic pectoralis angina. So what is the etiology of the disease? It's a combination, it's a great composite that we'll see. Any patient with hypertension, for example, should be assessed for hyperlipidemia, diabetes, and tobacco smoking is like additional risk factor here. Diabetes mellitus and hypertension from a long history of disease. Also, hypertension will develop a hypertrophy of the vessel wall, and this is like not reversible, and the vessel becomes stiff and cannot dilate properly. Hyperlipidemias like increased LDL fraction or triglycerides flow from chronic alcoholism or any pancreatic disorders. Clinical presentation: so from a decreased blood supply to the lower extremities mostly, and to upper too, because it's called peripheral artery disease. We'll have a pale member or a pale leg, also hair follicles, sweat glands, sebaceous glands, and hair loss will be will be seen in patient. One of the pathognomonic is pain in the legs during exercise that is relieved immediately by resting. So how to diagnose the disorder? Best initial test is ankle brachial index. By definition, we see in what consists this test. It's blood pressure measured on ankle arteries and on brachial, and a ratio between them will show us what is the deviation. Normally it should be like 1 or equal, but sometimes we have increased blood pressure in the lower limbs just from a gravity property. So most accurate test is angiogram. Angiogram is rarely used, and I can call it invasive because we infuse a contrast, because also we exposure patient to CT, but it is necessary after vascularization or revascularization, and to see how well is done surgery. Let's explain here what means that numbers from ratio. Normal range is from 0.91 to 1.3, and if you see range more than 1.3, it suggests a calcification of the arteries. One of the great example is Mockenberg arteritis. A value of less than 0.9 is considered abnormal, and less also suggests a degree of arterial obstruction, and less than 0.4 is considered advanced ischemia. What is the treatment? Best initial will be aspirin, stopping smoking if the smoking is a risk factor presenting, or cilostazol, and for sure if also patient have increased blood pressure and diabetes, maintaining these disorders properly with drugs. Also, lipid lowering therapy with statins is welcome here. Exercises that provide a collateral arteries development and improve the symptoms. So if vessels are damaged or sclerotic, drugs cannot help well on this. But if we give patient advice for exercising, collaterals will develop and blood supply will improve. So cilostazol, best drug is aspirin, and in combination with cilostazol. If patient cannot use aspirin, we give cilostazol. Cilostazol is a phosphodiesterase inhibitors that will increase adenine monophosphate, and as we know, cyclic AMP is a vessel dilator and inhibit also platelet aggregation and will prevent thrombosis, arterial thrombosis. Thank you for watching me and following me. Also, if you would like to be updated with my videos, please subscribe to my channel. Have a good day.